the talk of Connecticut.
Well, I'm so pleased to say that we are going to have the opportunity, the distinct pleasure of having some regular on-air conversations with folks from Bristol Hospital. And today I'm so pleased to be able to introduce to the show, he is the director for emergency medicine at the hospital. And we're going to talk about something that is so important. Last week, it was so important when folks did not have power and were using generators. Now that we, plain and simple, are into the cold weather and people are using kerosene heaters, it's also so important talking about carbon monoxide poisoning. So pleased to welcome to the show Dr. Craig Mittleman. Doctor, good afternoon.
Good afternoon, Mary. Thanks so much for having me.
Well, thank you for joining us today. I've been so looking forward to our conversation. Again, Director of Emergency Medicine at Bristol Hospital. Boy, you just see a little bit of everything in the ER room.
Yes, we do, and it's one of the neat things about, I think, our specialty in emergency medicine is getting the opportunity to be at times a pediatrician, at times a trauma specialist, and at times a cardiologist is really one of the, I think, the gifts of our specialty.
Now, and I was just going to ask before we get to carbon monoxide poisoning, which is so important these days, emergency medicine is an actual specialty in the world of medicine. Is that correct?
Yes, it is. I can't tell you, I recall exactly how many years it has been defined as a independent specialty, but physicians who go through medical school make a distinct choice to go into emergency medicine, and they apply for a special residency or post-medical school training in emergency medicine, and it's quite competitive, so it tends to lend itself to very, very bright physicians, and they go on to 3 and mostly 4 years of specialty training in just emergency medicine alone.
Wow, and as you mentioned, Doctor, the expertise has to be much broader than deep, if I can put it that way.
That's true. That is true. Some people have said that at times we're a jack of all trades, master of none, but I think that in the art of emergency medicine, I think, and the ability to manage all those different patients, and sometimes very ill patients, unfortunately, all at the same time takes a special skill.
Oh, absolutely. My goodness, very impressive. Thank you again so much for joining us today, Dr. Craig Middleton. Well, let's get, if we may, to carbon monoxide poisoning. As I mentioned last week, folks were talking about it in terms of so many people relying on generators. Now that I know this morning when I left work, it was 25 degrees in my hometown. And so we are into the cold weather, like it or not. So a lot of people are using additional sources of heat. So this time of year for carbon monoxide poisoning, I mean, it's got to be more prevalent. And why is that exactly? We hear about it, but we don't really all understand it, Doctor. That's where you come in.
Well, carbon monoxide is, as you had mentioned, and you gave it a good discussion early on, is a gas, and it is produced by combustion engines, like generators that use gasoline or at times propane. It also is created and generated in propane heaters, space heaters. Some of the camp stoves that a lot of people have brought indoors, particularly during this time when there's no heat and there is no power to fuel a stove. So all of the combustion engines generate as a byproduct carbon monoxide. The problem with carbon monoxide and why it's so dangerous and deleterious is because it competes with oxygen. And when it competes with oxygen, it actually pushes the oxygen molecule away from the red blood cell that's carrying the oxygen to all of our vital organs. So the red cell thinks that it's actually got oxygen on it, but it's really got carbon monoxide, which our bodies cannot use effectively. So you literally are starving of oxygen. So one of the things that's problematic is that you can't smell it, you can't taste it, and unless you're thoughtful enough to know that those combustion engines in your house are producing carbon monoxide, you could be a victim of it.
And just to get right to it, one can die.
One can absolutely die from carbon monoxide. It is a silent, and tasteless and odorless killer. I will tell you that the difficult and the challenging time right now is for those homes that are powerless. Many of them probably have operating carbon monoxide detectors. And my hope is that if nothing else, that those carbon monoxide detectors usually have battery backup systems so that if the power goes out and the carbon monoxide levels go up, that those detectors are still able to detect increasing carbon monoxide levels in a home. The other thing is that if they don't have carbon monoxide detectors, these are things that are readily available at Ace Hardware or any hardware stores in your town or some of the home service facilities that we all know that are pretty much available almost all the time.
Some of those big box stores.
Those big box stores. There
Yes.
you go. I don't want to... Yeah, that's correct. So those things are very important to have in your home, and they can really save your life and save the lives of your children, because these are the sort of things that build up very slowly and very gradually and cause a lot of symptoms that many of us would think are the same sort of symptoms that you might have on a stressful day or with a cold. Dull headache, runny nose, any body aches, feeling lethargic or sleepy. So it's really one of those things that you could easily pass off to just being a difficult day or having a little cold settle in. And very often people will take some medication and at times just go to bed thinking that when they wake up they're going to feel better. And in fact, if you go to bed and carbon monoxide is being produced in your home and those levels are continuing to increase, then the level of toxicity goes up, and that's when you get into the situation that you just referred to where it can become fatal.
Dr. Craig Mittleman, Director of Emergency Medicine right at Bristol Hospital, is with us today sharing his expertise about carbon monoxide poisoning. So, Doctor, you say that there are there are symptoms, but there aren't symptoms in terms of carbon monoxide gas. You can't see it, you can't taste it, you can't feel it per se.
That's right. And that's why, Mary, what we're trying to get out, particularly not only during the after-storm challenges that we're facing, but the cold temperatures. As people start to fire up some of these combustible engines in their home, they have generators that are either too close to the home or in the home in certain circumstances, is really recognition of what items that you may have in your garage or that you may be borrowing from a neighbor that can generate carbon monoxide. So recognition is important. The other thing is obviously carbon monoxide detectors, which have become very prevalent over the last decade, and making sure that if you don't have a carbon monoxide detector in your home, to get one and to make sure that it has a battery backup.
And so you're recommending everyone have a carbon monoxide detector in their home, everyone.
Absolutely. And not only, even if you would never have any combustible engines in your home, and you live in a condo or a townhome or an apartment complex, that gas is so prevalent that somebody else or a neighbor might have one of those gases, and you want to be sure that you're able to pick up levels that might be seeping into your house from a neighbor next door or downstairs.
All right, so there's message number one that hopefully everyone will take away from this conversation with Dr. Mittleman, Director of Emergency Medicine in Bristol Hospital, at Bristol Hospital in Bristol. Get a carbon monoxide detector, point number one. Point number two, Doctor, when someone comes to your emergency room with symptoms that you and your staff may suspect might be carbon monoxide poisoning, how do you treat it?
Well, the first thing, and you hit the nail on the head, Mary, is detection. So we really are all, as emergency department personnel, very alerted this time of year that even the most simple flu-type symptoms can be masked or mask carbon monoxide toxicity. So we're very alerted to that. We have the ability to do carbon monoxide testing here at the hospital. It's a very quick test. It's easy to get information. But once it's detected, the first and the easiest treatment is oxygen. Because carbon monoxide, as I mentioned before, competes with oxygen for your red blood cells, if you oversaturate the body with oxygen, you can deplete your body of the carbon monoxide and get rid of the toxin. So that's really the mainstay of therapy, is 100% oxygen through a mask. There are the rare cases, and there are certain circumstances, albeit uncommon, where patients might benefit from what's called hyperbaric oxygen, and that's 100% oxygen under pressure. Many people have heard of that. There are hyperbaric oxygen chambers, and that's a very unusual and a less common treatment tool that's used.
I'm thinking, doctor, and this is just not self-serving because it's not, I'm not asking on behalf of myself, but a neighbor who over the weekend was telling me and my husband that they had just purchased a kerosene heater. And I said, oh, that needs to be vented, doesn't it? And he said, no, this does not need to be vented.
Yeah, all combustible heaters that use a fuel need to be vented, and you need to be aware that carbon monoxide is being generated. So absolutely, those are not uncommon causes and sources of carbon monoxide, and really should not be used in an enclosed space.
There you go. Words to the wise. Dr. Craig Mittleman, Director of Emergency Medicine, Bristol Hospital. Life-saving information, doctor. Now, one last question, if you have time for one last.
Of course.
If someone, let's say, does not have a detector, and after this conversation, hopefully everyone will, but let's say someone didn't as of yesterday, and they had a generator or a kerosene heater or something that was that they didn't vent or wasn't working well, whatever, and there was a buildup. When they left the house to go to work, let's say, and they're out in the air and they're no longer in the source, does that take care of it?
Very often it will. And what we find at times is that not only in the home but in the workplace, particularly this time of year, in auto shops or places where there is inappropriately or not adequately vented exhaust from cars, we will find that there are people who, while at work, develop a frontal headache or feeling ill. And then when they go outside or they go to lunch, they feel better, and it's not until they get back to work that they start to feel ill again. And I think you brought up a good point. If you do not have a carbon monoxide detector and you feel like you are at risk for carbon monoxide toxicity, I can't forget the importance of our local providers and fire departments. While I know that they are busy with fires this time of year, unfortunately, very often in the case of carbon monoxide concerns, they have detectors and can make available one of the firefighters from the department to come out and check your home for carbon monoxide. You'd have to call them first about their availability, but they carry those detectors with them all the time. Great
advice. And, of course, every town has its own fire department. Dr. Craig Mittleman with Bristol Hospital. Their website is filled, goo-gobs of important information. It is bristolhospital.org. The main phone number at the hospital is 860-585-3000. That's 860-585-3000. 3000. Again, bristolhospital.org. Doctor, I cannot thank you enough for your time and expertise today. Would love to invite you back and talk about some other areas, and there would be a whole lot to talk about with you in the world of emergency medicine.
There is, and we would love to be invited back. I think this sort of public service information about the services that we provide and the things that we can help prevent out in the communities is very, very valuable.
And as you mentioned, that you see everything from flu symptoms, I'm sure, to heart attacks, to first aid, cuts, everything from A to Z in your emergency room.
Yes, we do, and I think that we are very proud of the services that we provide in our department, and we'd like to be able to offer those services to those people who need it.
Dr. Mittleman, we're all about the personal around here. Where did you grow up? Are you from Connecticut, may I ask?
No, I grew up in New York City.
Oh.
Then I trained and went to medical school at the University of Utah in Salt Lake City, Utah.
Nice.
And then I came back to Philadelphia, where I did my specialty training in emergency medicine. So that was an area that certainly had plenty of experience with trauma and some of the unfortunate situations that you see when you live in a urban center like that.
Yes.
And I've been in Connecticut for about 17 years now.
Well, we are pretty lucky to have you.
Oh, I feel very fortunate that you would say that.
Well, I mean it with great sincerity. Dr. Craig Mittleman, again, the Director of Emergency Medicine over at Bristol Hospital. Do check out their website, bristolhospital.org. And their main phone number, one more time, is 860-585-3000. That makes it easy. Doctor, thank you so much once again.
Thank you for having me, Mary.
Have a safe day.
Okay, you too.
What a nice guy. Important information. I tell you, life-saving information. We'll take a break. We will be back with open phones, 1-888-574-2723. If there's anything on your mind on this lovely day, it's Election Day. Lots of sunshine out there. So glad to be hanging out with you. This is Mary Jones.
You're listening to The Mary Jones Show on the Talk of Connecticut.